Hello and welcome to the channel where we discuss medical topics and lifestyle. Today's video is about celiac disease, more specifically the signs and symptoms of celiac disease. So there's a lot to talk about. We're not going to jump into the diagnosis, the investigations, the management of celiac disease, but we're strictly focusing on the signs and the symptoms of celiac disease. So let's get right into it. Before we jump into those though, we need to go through some basic definitions, of course. So where is celiac disease? What is it? So there we have the intestines. Outlined in red is the small intestine, and the black around it is the large intestine. Celiac disease affects the small intestine. It doesn't touch the large intestine. It is a systemic autoimmune disorder. It is triggered by dietary gluten. So gluten sensitivity results in inflammation of the bowel and thus occurs malabsorption, and that leads us to all the signs and the symptoms. So what happens actually to the intestinal wall, to the small intestinal wall? You get mucosal inflammation. So that's inflammation. Imagine getting punched in the shoulder and it swells up and bruises up. That's inflammation. Crypt hyperplasia, so where the cells in the walls of the intestine, they start to change dramatically. And villus atrophy, so that's where the finger-like tentacles that line the wall, as you can see there on the left, those are the normal ones, and then they become atrophic, where they erode away and they flatten away, as displayed on the right side of the image, so those tentacles are flattened. The reason they are tentacle-like, these villi of the wall of the small intestine, is because it increases the surface area of the intestine where you need to absorb all the nutrients, and that's compromised when you have celiac disease. So let's go now into the signs and the symptoms. Now, the signs and symptoms, they can vary, and we're going to get into that in a second. And you can distribute this into kind of more male-dominated symptoms, female-dominated symptoms, childlike symptoms, but the whole gist of it is that it is variable. So there are lots of symptoms going on. Now, I'm going to give you some mind-blowing facts here. So only 36% of those living with the condition are diagnosed. So that just tells you how undiagnosed it actually is. Although 1% of the UK population has it, and I would wager it's similar in other populations, only 36% of those living with the condition are diagnosed. The other very important thing to consider here is that it can occur at any age, but it's most commonly diagnosed between the ages of 50 to 69. But the average length of time from onset of symptoms to the diagnosis is 13 years. So that's a very long time to be suffering with symptoms before getting diagnosed. So that's very important to keep in mind. I gave you some UK facts there, but it's probably similar in other populations and nations. Who is actually at risk of getting celiac disease? Yes, there is a family history component to it, so first and second degree relatives. There's also an association with the HLA-DQ2 and DQ8 genes as well. Type 1 diabetics are more prone to it. Autoimmune thyroiditis, so autoimmune thyroid issues, they can be more prone at risk of getting celiac disease, and also Down syndrome and Turner syndrome as well. So these are at-risk groups, and whenever these kinds of things are occurring, if these people are presenting with symptoms, it's good to get them tested. So what are the actual symptoms now of this flattening of the villi, of this gluten sensitivity and inflammation of the bowel? So you can have common gastrointestinal symptoms. That's the most common presentation, and that can present itself as in diarrhea, which can be foul smelling, so this can be of any age. Bloating as well can occur. You can have abdominal pain, which is quite vague, non-specific to a certain area, and generalized discomfort. So this is something that can then culminate into having weight loss. At least 20% of patients are asymptomatic. This goes in line with those statistics we were talking about earlier on and those facts. So then you can have extra-intestinal manifestations as well. So these can really vary. So we can have generalized fatigue. We can have dermatitis herpetiformis, which is a certain kind of skin condition associated with celiac disease and gluten sensitivity. Think of it as breaking out in the skin. Atrophic glossitis, so that is inflammation of the tongue as well, which can occur, and it can become flattened and atrophic in a similar fashion to the villi we were mentioning earlier on. And then you can have other presentations which can be a sign of celiac disease. So being iron deficient, being vitamin B12 deficient, having folate deficiency as well. So these are all things that can occur. Osteopenia, which is essentially weakened bones. And this is all because of malabsorption. So that inflammation causes malabsorption because our digestive system is compromised. We can't absorb what we need to absorb, and thus we have malabsorption. And this can present itself in various ways. So you can't absorb the nutrients that you need, you start to lose weight, you get diarrhea, and all these kinds of things. In children, it's particularly important because this showing itself there, because children are small, you can have faltering growth, delayed growth. You can have delayed puberty as well. So if that is there, you have to suspect it. Women as well. So this is something very important that not a lot of people speak about, is that the reproductive period is shorter than average. So this is because the average age of the first period is higher or later, and the average age of the menopause is also earlier, so thus the window is more constrained. So we need to think about the reproductivity of females as well. And then you can have an impact on the mental status as well and other manifestations. So you can have depression, anxiety, peripheral neuropathy, which is pins and needles in the fingers and the legs and other parts of the body. Fertility issues we mentioned. There can be teeth issues as well, so dental enamel effects. So those are important. Abnormal blood tests, liver enzymes in particular. So gluten sensitivity can present itself in various ways. And it's very important to keep these things in mind. So celiac disease can present in various different ways. It's not just the gastrointestinal symptoms that occur that prompt you to have to test for this. There can be extra-intestinal manifestations as well. And it's very important to keep those initial facts in mind. So at least 20% of patients are asymptomatic. Only 36% of those living with the condition are diagnosed. And the average amount of time it takes to be diagnosed and you're living with these symptoms is around 13 years. So it's a very important disease to recognize, to understand. We're going to dive into the diagnosis and the management of it in other videos, but this was a video on the signs and the symptoms of it to highlight some of the important differences, some of the important extra-intestinal manifestations that might not come across our minds sometimes, such as the reproductive period for women, catching it in children early if need be, and so on. Hope you enjoyed the video. Please like and subscribe for more. We'll see you in the next one. Take care.